Hey everyone, I'm Scotty from Scotty RNY, and this is my week 42 post-op Roux-en-Y gastric bypass update. And welcome everybody to another edition of the Red Eye Club with Scotty. I hope everyone out there had a great week, as I did. I am fantastic. It's bright and early in the morning, but I am still, well, it's not even bright, but it's early in the morning, and I am fantastic. Okay, let's do this. So I am 6'2", 45 years old. My highest weight ever recorded was 419 pounds in August of 2014. I had surgery July 7th, 2015 at Humber River Regional Hospital in Toronto, Ontario, Canada, and my surgeon was Dr. Hagen. My surgery weight was 340 pounds. Last week I was 218.4 pounds, and this week I am 218.6 pounds for a gain of 0.2. And still fluctuating around this goal weight of mine. So since surgery, a loss of 121.4 pounds, and a total loss from my highest weight ever recorded is 200.4 pounds. Yes, so again, keeping around my goal weight area, which is good. I'm absolutely fine with that. So I have some chocolate, as I always have some chocolate here. Yeah, I've had chocolate, but just not that chocolate, because that's a special chocolate. This past week, ran into somebody somewhere, maybe at work, and they said, wow, I wrote this down, so I'm going to read it the way I wrote it down. You're starting to fit into most clothes. Oh, I'm starting to fit into my clothes now. That's what the person said. Oh, you're starting to fit into your clothes now. I said, no. I've always fit into my clothes. It was just a 4 and 5XL before. And the person said, oh, you're right. But now you're fitting into smaller clothes. And he did say that, I was looking good and more fit now. So that was a great compliment to hear. But ironic, though, how people kind of perceive that, oh, you can fit into your clothes now. Well, I fit into it before, and that is the thing that they don't understand, is I did fit into it before. It was just 4 and 5XL. But I guess, that when you see somebody slimmer, then they think that you can fit into clothes now, because maybe they're gearing it around what they are if they're a fit person as well. Oh well, but it was great to hear, though. Went to a potluck the other night and had some lasagna, vegetarian lasagna. It was good, didn't have any problems with the pasta in it. The cheese wasn't too bad either. I only ate a little bit and picked out the corn because I'm still not trying corn yet. My choice, just don't really care to try corn yet. I'm sure if I, really small, it probably would have been fine. But I'm just going to avoid that because I've heard some people have a bit of issue with corn, and I don't need to go down that road yet. Let's see. Oh, yes. So I went to the gym a couple of times this past week. It was good. The last time I was at the gym, though, on Saturday, I don't know what the heck I was doing, something, and I felt a little tweak down my right hip. And I was like, oh, that's a little something. I don't care for it so much, but oh well, I'll carry on. So I do my weights like I'm doing, and then I go hop on the bike like I normally do, and I do my half hour or so on the bike. Oh, by Saturday night, I was having a hard time getting comfortable. The pain ends up being my TFL, the tensor fascia lata, which has been strained, which I've done before over the years. And yeah, Sunday I could hardly walk, sit, stand. It only hurt when I was awake, if that helps. So it's been getting better. Ice, heat, stretching it out a bit, resting it, repeat. So if you're doing something out there and you notice a little tweak, especially if you know that what that tweak is from before, don't continue doing whatever you're going to do. Just stop right there and go take care of it, because in the end, it may not be worth doing that little bit of extra exercise just to make sure your weight is maintained. Take care of your body, and that means listening to any little aches and pains and stopping your exercising because of it, so you prevent further problems. Otherwise, no, I'm fine. I'll get through it, no problem. Oh, and on Sunday, went to a little brunch, a very nice brunch with the family, parents, and stuff like that. And it was run by some seniors. And I went up to the buffet table, and my daughter was helping her uncle, who's the cook of the place, and she had made the pancakes, so I had to have pancakes. So I go up to the pancake area, have a pancake or two, some bacon, and the woman's like, "Oh, do you want some hash browns and potatoes?" And I'm like, "No." I said, "I'm good, thanks. I just, I have to kind of watch, what I'm eating." And well, how the heck did she write it? She wrote something to the effect of, or she said, she said something to the effect of, "You look like you don't have to worry about watching what you eat." Oh. I said, "Well, thank you very much, but I do have to worry because I just lost a whole lot of weight." "Oh, that's great. How did you lose your weight?" I said, "Well," and I normally don't tell people because I'm still somewhat in the closet, even though I'm on videos, but I said to her, "Well, I had gastric bypass surgery." Her response, "I'm sorry, I didn't mean to pry." So what is that? Is that a taboo thing for older people? Maybe she had a bad experience talking to a few people before and they had gastric bypass surgery and it was bad for her. She wasn't prying, she asked, and I came right out and told her instead of saying I had a lifestyle change. So, and I didn't get a chance to go back and ask her, what did you mean by that? But I thought that was really weird, that really nice older lady, but I didn't mean to pry when I said that. So, yeah. It is what it is. So that was my weird week for this week. Yeah. So hopefully you guys are doing great. A couple more subscribers again this week. Thank you. And again, thank you to all my loyal people out there. You guys are fantastic. Oh, yes. Let me get back to my daughter's pancakes that she made. They were delicious. Yes, they were. They're absolutely delicious. Okay. So like the videos and share the videos however you like to share the videos. And of course, as always, if you want to get in touch, Google+. So that's going to be about it for this Red Eye edition, everybody, this week. We'll see you again next time. Thanks, take care, and bye-bye.